Imagine a man lying on the packed earth floor of a windowless house. His entire body is covered in open sores, wounds that haven't healed for months, perhaps years. The surrounding skin is swollen and darkened, with a smell of rotting flesh so strong that no one from his own family can stand to stay in the same room. He cannot touch his wife, he cannot hug his children, he cannot enter the temple, he cannot set foot in the marketplace. If someone approaches him on the street, he is required by law to shout a single word that destroys any remnant of dignity he still has. Unclean. He screams this so people have time to turn away, to flee from him as if he were death itself walking. This was not a rare case. It was not a tragic exception. This was the daily life of thousands of people in the biblical world. And the most disturbing part? No one, absolutely no one, knew what caused it. There were no microscopes. There was not the slightest notion of bacteria, viruses, or microbiological contagion. For the ancient world, disease was not medicine. Disease was theology. It was punishment. It was a curse. It was the finger of God, or the devil, touching your flesh. But here is the question almost no one asks. If these people had no idea what caused their illnesses, how did they survive? How is it possible that entire civilizations existed for millennia without antibiotics, without anesthesia, without the most basic notion of hygiene that a 5-year-old has today? Furthermore, when you read the laws of Moses written over 3,000 years ago, you find instructions for quarantine, isolation, and decontamination so precise, they seem to have come from a modern manual of epidemiology. How is this possible in an era when people thought diseases came from demons? The answer will shock you, because what archaeology and modern medicine have discovered about the diseases of the biblical world reveals something no one expected to find, a sophistication that defies everything we thought we knew about the ancient world. To understand what it was like to get sick 2,000 years ago, you must first forget everything you know about medicine. Erase from your mind the image of hospitals, pharmacies, and doctors in white coats. Erase the idea of a diagnosis. Erase the idea of treatment. Now imagine the following scenario. You wake up one morning with a stomach ache. It's not just any pain, it's a pain that burns, that tightens, that makes you double over. You don't know it, but a parasite entered your body through the water you drank yesterday from a well shared with animals. That parasite is literally eating the lining of your intestine at this very moment. What do? There is no emergency room. There is no doctor in your village. In fact, in the entire region of first-century Galilee, it is estimated that there was less than one doctor for every 10,000 people. And even if there were one, what would that doctor do? He has no x-rays, he has no blood tests, he has no ultrasound. The most he can do is press on your belly, look at the color of your tongue, smell your urine, yes, smell it, and then give you a mixture of herbs that could either help you or poison you, because no one has tested it in a controlled way. No one has ever conducted a clinical study. Doctor is operating based on oral tradition, superstition, and trial and error accumulated over generations. And here enters a detail that changes the entire perspective. In the ancient world, the profession of a doctor did not have anywhere near the prestige it has today. The Talmud, the compilation of Jewish traditions, has a brutal sentence about this. It says, loosely translated, the best of doctors deserves hell. It seems like an exaggeration, but it reflects a deep distrust that the biblical world had toward those who proposed to heal the body. And for a simple reason, most treatments did not work. Many killed. The book of 2 Chronicles chapter 16 verse 12 tells that King Asa of Judah had a severe disease in his feet. The text says something revealing. Yet in his illness he did not seek the Lord, but the physicians. And the result, Asa died. The biblical text treats this almost as a warning. You trusted doctors instead of trusting God, and look what happened. This gives you the exact dimension of how the mentality of the time worked. Disease and spirituality were so fused that it was impossible to separate one from the other. When you got sick, the first question wasn't, "What do I have?" The first question was, "What did I do wrong? What sin did I commit? What commandment did I break? Whose fault is it? Mine, my parents, my grandparents?" Jesus' own disciples thought this way. The Gospel of John chapter 9 records a revealing moment. Jesus and his disciples encounter a man blind from birth. And the first thing the disciples ask is, "Rabbi, who sinned, this man or his parents, that he was born blind?" Do you see the logic? For them, blindness from birth could only be explained by sin. Someone messed up. Someone offended God. The disease is the punishment. And Jesus' response completely breaks this paradigm. He says, neither this man nor his parents sinned. In a single sentence, Jesus dismantled centuries of popular theology that treated every illness as divine punishment. But this mentality didn't only exist among the Jews. In ancient Egypt, disease was an attack by demons. In Mesopotamia, it was the fury of the gods. In Greece, Hippocrates, who is considered the father of medicine, tried to separate disease from superstition around 400 BC, but even among the Greeks, most people continued to believe that plagues came from the gods. Homer's Iliad literally begins with Apollo firing arrows of pestilence upon the Greek army. For the entire ancient world, without exception, disease was supernatural. If you believe that God's wisdom is revealed in the most unexpected details of the Bible, comment below. God knows everything. Now let's dive into the real diseases that tormented the biblical world. And to do this right, we must start with the most famous, the most feared, the one that generated more social horror than any other: leprosy, or rather what the Bible calls leprosy. Because here is a twist that most people are completely unaware of. The Hebrew word used in the Old Testament is tsara'at. For centuries, translators translated this word as leprosy, the disease we now call Hansen's disease, caused by the bacterium Mycobacterium leprae. But when modern researchers analyzed the biblical descriptions of tsara'at with medical eyes, they discovered something surprising. The symptoms described in Leviticus chapters 13 and 14 do not correspond to Hansen's disease. Not at all. Hansen's disease causes loss of sensation, muscle atrophy, and deformation of the fingers and face. But what Leviticus describes is different. White spots on the skin, swellings, rashes, hair that changes color, sores that spread or recede. This sounds much more like psoriasis, vitiligo, dermatitis, or even fungal infections. So what was tsara'at really? The most honest answer is, no one knows for sure. What we do know is that it was an umbrella term, a broad category that encompassed several different skin conditions. And the most fascinating thing is that tsara'at did not apply only to people. Leviticus says that clothes could have tsara'at. Leviticus says that houses could have tsara'at. Clothes and houses with greenish or reddish spots that spread. When you read this with modern eyes, do you know what it looks like? Mold, fungi, mildew. The biblical text was describing fungal contamination in fabrics and walls, and it commanded the destruction of the contaminated material or even the demolition of the house if the problem persisted. Think about how absurd that is. 3,500 years ago, long before any human being knew what a fungus was, the Mosaic laws already commanded isolating contaminated material, observing if the contamination spread, and destroying the source if it couldn't be contained. This is contamination control protocol, and it was written on parchment at a time when the rest of the world was rubbing dove's blood on wounds and praying to stone statues. But let's go back to the people, because the social impact of tsara'at was devastating in a way that is hard to comprehend today. Leviticus 13:45 and 46 describes the full protocol. The person diagnosed with tsara'at had to tear their own clothes. They had to let their hair hang loose and disheveled. They had to cover their upper lip like a mask. And they had to live outside the camp, separated from everyone, alone. Visualize this. You are a father. You work. You provide for your children. You go to the temple. You participate in the community. One day, a strange spot appears on your arm. You go to the priest because it wasn't the doctor who diagnosed, it was the priest. He looks, examines, and tells you to stay isolated for 7 days. You come back, the spot has spread. The priest pronounces the sentence, unclean. At that moment, your life is over. Not your biological life, your social life. You are torn from your home, your family, your work, your community, your place of worship. You begin to live outside the walls, usually with other unclean people in miserable conditions. No income, no support, depending on charity. And no one knows for how long. It could be weeks, it could be years, it could be the rest of your life. The second book of Kings, chapter 7, tells the story of 4 men with tsara'at who lived outside the gates of Samaria. The city was besieged by the Aramean army. Inside the walls, there was absolute famine. The text says that a donkey's head was being sold for 80 pieces of silver. Outside the walls, these 4 men lived between 2 horrors, the hunger of the city and the enemy army. And the sentence one of them says is heartbreaking. Why are we sitting here waiting to die? They were so excluded that not even the catastrophe of an entire city starving to death included them. They were invisible, living ghosts. And this is the context that makes Jesus' healing miracles so revolutionary. When Jesus touches a leper in Matthew chapter 8, touches with his hand the skin of a man no one had touched for years, maybe decades, he is not just healing a disease, he is breaking the most insurmountable barrier of that society. Touching was forbidden. It made the one who touched ritually unclean as well. Jesus knew this, and he touched him anyway. Before saying, "Be clean," before the miracle happened, he reached out his hand and touched him. The order of events matters. The touch came first, the healing came after. If this story touched you, give it a like right now. Seriously, the like helps this video reach people who need to hear this. But tsara'at, as terrible as it was socially, was not the disease that killed the most in the biblical world. Not even close. The real terror, the invisible enemy that could decimate an entire city in a matter of days, had another name. Biblical texts call it simply pestilence, in Hebrew, deva. And when you start to investigate what that word really meant, what you discover is so disturbing that it will completely change the way you read the Old Testament. Because the biblical pestilence was not a disease, it was an event. A biological cataclysm that appeared without warning, without visible explanation, and killed on a scale that defies the modern imagination. The book of 2 Samuel chapter 24 records one of the most terrifying episodes in the entire Bible. King David makes the mistake of taking a census of the people, an act the text treats as a sin of pride. And the consequence? God sends a pestilence upon Israel. In 3 days, just 3 days, 70,000 people died. 70,000. To understand the scale, the estimated population of Israel at that time was about 1.5 million people. This means that in 72 hours, almost 5% of the entire nation was eliminated. If something like this happened in the US today, it would be equivalent to more than 16 million deaths in a single weekend. The text says that an angel with a drawn sword hovered over Jerusalem, ready to destroy the entire city when God commanded him to stop. "It is enough," said the Lord. The angel was at the threshing floor of Araunah the Jebusite, and it was exactly there that David built an altar, and later Solomon built the temple. The place where death stopped became the most sacred place in Israel. Think about that. The temple in Jerusalem was literally built on the exact spot where a plague ceased. But what was this pestilence after all? What disease kills 70,000 people in 3 days? Modern researchers have a few theories, and none of them are comforting. The most accepted one is that it was bubonic plague, the same disease that killed a third of Europe in the Middle Ages, caused by the bacterium Yersinia pestis, transmitted by rat fleas. Bubonic plague has a mortality rate of 60 to 90% without treatment. The symptoms are horrific. Extremely high fever, swollen buboes the size of eggs in the armpits and groin, vomiting blood, tissue necrosis, blackened skin. Death can come in less than 48 hours after the first symptoms. Another possibility is cholera, transmitted by contaminated water, capable of killing by dehydration in hours, or bacterial dysentery, which turned entire military camps into killing fields, or typhus, spread by lice, which thrives in crowded conditions and lack of hygiene. The truth is that the ancient world were breeding ground for all these diseases at the same time, and when one emerged, there was absolutely nothing that could stop it, unless it ran its course, or people died too fast to continue transmitting it. And here enters something that few people realize when they read Exodus. The 10 plagues of Egypt, those you learned in Sunday school as isolated miraculous events, when analyzed in sequence with medical eyes, form a perfect epidemiological chain. One triggers the other. Water turned to blood? This could indicate an explosive proliferation of toxic algae, the phenomenon known as red tide, which poisoned the Nile. This killed the fish. Dead fish forced the frogs out of the water, the second plague. Frogs dying in mass in the streets generated an accumulation of decomposing organic matter. This attracted insects, lice and flies, the third and fourth plagues. Insects transmit diseases to animals, pestilence on the livestock, the fifth plague. Ulcers on human skin, the sixth plague, consistent with bacterial infections transmitted by the same insects. Do you see the pattern? Each plague creates the conditions for the next. It is a biological domino effect so precise that epidemiologists from Yale University have published studies mapping exactly how this could work in natural terms. This does not diminish the miraculous aspect. In fact, it amplifies it, because it suggests that the divine power described in Exodus did not ignore the laws of nature. He orchestrated them. Like a conductor who doesn't need to invent new instruments, he simply makes the existing ones play the melody he wants at the exact moment he chooses. But here is the detail no one tells you about the plagues and health in ancient Egypt. Egypt was not a primitive place in terms of medicine, quite the opposite. Egypt had the most advanced medical tradition in the ancient world. The Edwin Smith Papyrus, dating from about 1600 BC, contains 48 medical cases documented with diagnosis, treatment, and prognosis. The Egyptians performed surgeries. They treated fractures with splints. They stitched wounds. They had specialists, eye doctors, tooth doctors, stomach doctors. Herodotus, the Greek historian, wrote in the 5th century BC that Egypt is full of doctors, each specialized in a single disease. And yet, even with all this sophistication, when the plagues came, the Egyptian doctors could do absolutely nothing. Exodus records an almost ironic detail. The magicians could not stand before Moses because of the boils, for the boils were on the magicians. The healers themselves were sick. The specialists were covered in the same sores they were supposed to treat. The most advanced medicine in the ancient world was brought to its knees. If this surprised you, comment, "I didn't know," because what comes next is even more impressive. While Egypt, with all its medical tradition, was being devastated by plagues, a nomadic people in the desert received a code of sanitary laws that would only make full sense 3,500 years later. The laws of Moses. And when you analyze these laws with the eyes of a modern doctor, what you find is disturbingly precise. Leviticus 11 prohibits the consumption of pork. For millennia, critics considered this an arbitrary superstition. Today, we know that the pig is the main vector of trichinosis, a parasitic infection caused by the worm Trichinella spiralis, which, without modern treatment, can be fatal. The pig is also a host for tapeworms, whose larvae can migrate to the human brain, causing cysticercosis. In a world without refrigerators, without thermometer-controlled cooking, without sanitary inspection, eating pork was biological Russian roulette. Leviticus 11 also prohibits seafood without scales or fins, meaning crustaceans and mollusks, shrimp, oysters, mussels, crabs. Exactly the animals that are natural biological filters. They feed by filtering the water, and with it, they absorb all the toxins, bacteria, and heavy metals from the environment. Eating a raw mollusk collected in contaminated waters is basically drinking a concentrate of everything toxic in that water. Without refrigeration, in a hot climate region like the Middle East, the risk of severe food poisoning was enormous. But perhaps the most impressive law of all is from Deuteronomy chapter 23, verses 12 and 13. It says, and I will paraphrase, that when the Israelites camp, they must designate a place outside the camp to relieve themselves. And each person must carry a spade along with their equipment, and after defecating, they must dig a hole and cover the waste with earth. Seems obvious, right? Seems like common sense. But it wasn't. It wasn't obvious to anyone at that time. Entire armies in antiquity died not from battle, but from dysentery, because they camped, defecated in the same place where they slept and cooked, contaminated the water, and in weeks the disease swept through the camp. In the American Civil War, this is the 19th century, more than 3,000 years after Moses, for every soldier who died in combat, 2 died from infectious diseases caused by poor sanitation in the camps, and the Mosaic text, written in the Bronze Age, already commanded burying waste outside the camp. Numbers 19 prescribes something even more extraordinary. When someone touched a corpse, they were to be considered unclean for 7 days. They had to wash with water on the 3rd and 7th days, and they had to stay separated from the camp during that period. This is post-exposure quarantine. The incubation period for most bacterial diseases transmitted by corpses is 2 to 7 days. The Mosaic protocol covered exactly that window. And the washing of hands. Leviticus prescribes hand washing and a full bath after touching dead bodies, after contact with bodily secretions, after contact with sick people. Ignaz Semmelweis, the Hungarian doctor who discovered that washing hands reduced mortality in maternity wards, made this discovery in 1847. He was ridiculed by the medical community, called a madman, and died in a mental asylum. It took the scientific community decades to accept that he was right, and the text of Leviticus had already prescribed washing after contact with biological contaminants 3.5 millennia earlier. Now, I need to be honest here. The biblical text does not explain the why of these laws. It doesn't talk about bacteria. It doesn't talk about microbiological contamination. The justification given is purely ritual, that you may be holy, for I am holy. The logic presented is theological, not medical, but the practical effect was identical to what modern medicine would prescribe. And this raises a question that bothers skeptics and fascinates historians. How is it possible that a code of laws written by nomads in the desert contains epidemiological principles that the civilized world would only discover millennia later? But if the laws of Moses offered remarkable protection against contagion, that didn't mean people didn't get sick. They did, a lot. And what happened when they did? The treatments, the remedies, the available medical procedures was something that would make any modern person grateful to have been born in the 21st century. Because what passed for medicine in the ancient world could be as dangerous as the disease itself. Let's start with what the doctors of the ancient world had at their disposal. Imagine you live in Jerusalem in the year 700 BC. You wake up with an unbearable headache, a fever that won't break, a wound on your arm that is turning red, swollen and hot to the touch. What do? There is no hospital, there is no pharmacy, there is no emergency room. What exists are healers, a mixture of priest, herbalist and, in many cases, charlatan. And the available therapeutic arsenal was a bizarre combination of things that worked by pure chance, things that did absolutely nothing, and things that could kill you faster than the original disease. The Ebers Papyrus, one of the oldest medical documents ever found, written in Egypt around 1550 BC, contemporary to the period when the Israelites were supposedly in Egypt, lists more than 800 medical recipes. Some are surprisingly reasonable. Honey for wounds, for example. Today we know that honey has real antibacterial properties. It produces hydrogen peroxide in low concentrations, and its high sugar concentration dehydrates bacteria through osmosis. Manuka honey, used in modern hospitals, works by the exact same principle that an Egyptian healer applied 3,500 years ago without having the slightest idea why. But alongside these recipes that worked, there were others that make your blood run cold. The same Ebers Papyrus recommends for a headache a mixture of crushed catfish skull with snake fat, boiled and applied to the forehead. For baldness, an ointment made with fat from a hippopotamus, crocodile, cat, snake, and mountain goat, mixed in equal parts. For eye infections, and eye infections were epidemic in the ancient world because of flies, sand, and lack of hygiene, the recipe included bat excrement mixed with honey. You read that right, bat feces in the eyes to treat an infection. It's like trying to put out a fire by throwing gasoline on it. And the most disturbing thing is that this wasn't the medicine of primitive peoples. This was the most advanced medicine on the planet at that time. The Egyptians were at the top of the chain. What was done in other cultures was often worse. In Mesopotamia, the cradle of civilization, medical tablets found in Nineveh reveal that the primary treatment for most diseases was exorcism. I'm not speaking metaphorically. Literally, the Mesopotamian doctor, called an ASU, worked alongside the exorcist, the Ashipu, and often they were the same person. The diagnosis consisted of identifying which demon had invaded the patient's body. Disease was not seen as a biological dysfunction, it was possession, spiritual invasion, and the treatment was to expel the invader. How? With incantations, with amulets, with fumigation. They burned substances around the sick person so the smoke would drive away the demon. Sometimes they tied a live goat next to the patient so the demon would jump into the animal. Then they killed the goat. And if the patient died anyway, the conclusion was not that the treatment had failed. It was that the demon was too powerful, or that the patient had hidden sins that prevented the healing. And it was in this world that the Israelites lived, surrounded by cultures that treated disease with magic and exorcism, and that's exactly why certain biblical passages gain a completely different weight when you understand the medical context of the time. The book of 2 Chronicles, chapter 16, verse 12, tells the story of King Asa of Judah. Asa reigned for 41 years. He was considered a good king for most of his reign, but at the end of his life, he developed a severe disease in his feet. The text says the disease was exceedingly great. Many scholars believe it was gangrene, possibly caused by diabetes, possibly by peripheral vascular disease, the feet slowly rotting. The pain must have been unbearable, but the devastating detail is in the next sentence. The text says, "Yet in his illness he did not seek the Lord, but the physicians." And this sentence is not a compliment. It is a condemnation. The text is saying that Asa made a mistake by trusting doctors instead of trusting God. 2 years later, Asa died. The theological message is clear. But the medical message is also clear. The doctors available to the King of Judah, the most powerful man in the nation with access to the best resources, could do nothing for him. Absolutely nothing. And Asa was not the only biblical king destroyed by disease. The second book of Chronicles, chapter 21, describes the death of King Jehoram, son of Jehoshaphat. Jehoram was a terrible king. He killed his own brothers to consolidate power, allowed idolatry, and according to the text, received a letter from the prophet Elijah saying he would be punished with an incurable intestinal disease. And that is exactly what happened. The text says that his intestines came out because of the sickness, and he died in great agony. His intestines came out. The description is consistent with what modern medicine calls severe rectal prolapse, possibly caused by chronic amoebic dysentery or an advanced intestinal tumor. He suffered for 2 years before dying. And the final verse about Jehoram is of an almost cruel coldness. He passed away to no one's regret. King Herod the Great, the same one who ordered the massacre of children in Bethlehem, died of a condition that the historian Flavius Josephus describes with such graphic detail that doctors to this day debate the diagnosis. Josephus says that Herod suffered from unbearable itching all over his body, constant abdominal pain, swelling of the feet, inflammation of the abdomen, gangrene of the genitals that produced worms, difficulty breathing and convulsions, worms, in the genitals while alive. Modern researchers have proposed dozens of diagnoses: chronic kidney failure, liver cirrhosis, advanced diabetes with gangrenous complications, or a combination of several simultaneous diseases. The most cited article, published in the Journal of the Royal Society of Medicine, suggests that Herod suffered from chronic kidney failure complicated by Fournier's gangrene, a necrotizing infection of the genital tissues that is fatal in 40% of cases even with modern medicine. But it wasn't just kings who suffered. Daily life in the biblical world was an endless sequence of health risks that simply no longer exist in the developed world. Let's talk about something no one mentions: teeth, your teeth. Think about your teeth right now. You probably brushed this morning, maybe flossed, maybe have a filling or two, maybe wear braces or have had a root canal. Now imagine a world without any of that. No brush, no paste, no dentist, no anesthesia, no fillings, nothing. Analyses of skulls found in excavations in Israel, Jordan, and Egypt show rates of decay and periodontal disease that are terrifying. A study published in the American Journal of Physical Anthropology analyzed 283 skulls from the Iron Age in Israel, exactly the period of the kings of Israel and Judah, and found that more than 65% of adults had at least one advanced cavity. More than 40% had dental abscesses, pockets of infection at the root of the tooth that caused constant pain, fever, and swelling in the face. And dental abscesses killed. The infection could spread to the jaw, the neck, or the brain. A simple toothache could kill you in 2 weeks. The treatment? There was no treatment. If the pain became unbearable, the option was to pull the tooth, without anesthesia, with a tool that was basically a crude metal plier. Bite a piece of leather, someone holds you down, and the healer pulls until it comes out. If it broke, even worse, root fragments rotting inside the gum, infecting for weeks. Proverbs 25, verse 19 says, "Confidence in an unfaithful man in time of trouble is like a broken tooth and a foot out of joint." The metaphor only works if the audience knew exactly what it was like to live with a broken tooth. And they did. Everyone knew, because almost everyone had one. And if teeth were already a torture, imagine something even more common, even more lethal, and even more ignored by most preachers and teachers: intestinal parasites. Because they were everywhere, absolutely everywhere. In 2014, archaeologists from the University of Cambridge published a study that analyzed soil samples collected from latrines and cesspits from archaeological sites across the Middle East, dating from 2000 BC to the Roman period. What they found was a microscopic gallery of horrors. Eggs of Ascaris lumbricoides, the roundworm, which can grow up to 14 inches inside the human intestine. Eggs of Trichuris trichiura, the whipworm, which attaches itself to the wall of the large intestine and feeds on blood, causing chronic anemia. Eggs of Taenia, the tapeworm, which can grow up to 40 feet, inside the human body and live there for up to 25 years. Fasciola hepatica, the liver fluke, contracted by drinking contaminated water or eating raw vegetables washed with river water. And Entamoeba histolytica, the parasite that causes amoebic dysentery, responsible for bloody diarrhea, severe abdominal pain, and, in severe cases, liver abscesses that could be fatal. These parasites were in practically the entire population, not in some, in almost everyone. A study in similar archaeological sites in Egypt found intestinal parasite eggs in more than 90% of the soil samples associated with human dwellings. 90%. This means that living in the biblical world was to live permanently infested. Worms in the intestine were as common as lice in the hair, and lice were also universal. And the effects were devastating, especially in children. Intestinal parasites compete with the host for nutrients. A child with roundworms does not absorb the food they eat, the worm absorbs it first. The result is chronic malnutrition even when food is available, stunted growth, anemia, weakness, a compromised immune system, which opens the door to all other diseases. It is estimated that intestinal parasites were the underlying cause of up to 30% of childhood deaths in the ancient world. They didn't kill directly, but they weakened the body so much that any secondary infection became lethal. And this leads us to the most brutal statistic of all about health in the biblical world, the number that makes everything else seem small in comparison: infant mortality. Brace yourself, because these numbers are hard to hear. Demographic studies based on analyses of ancient cemeteries in Israel, Jordan, Egypt, and Mesopotamia show that approximately 30 to 40% of all children born in the ancient world died before reaching age 5, 1 in 3, sometimes 2 in 5. I'm not talking about times of famine. I'm not talking about periods of war. I'm talking about normal years. This was the baseline, the reference line. Being born was already a lottery that almost half of the children lost. The number one cause: diarrheal diseases. Diarrhea, something we treat today with oral rehydration salts and, in more severe cases, with simple antibiotics. In the ancient world, diarrhea in a young child was often a death sentence. The child dehydrated in hours, no salts, no intravenous rehydration, nothing. Mothers watched their children wither like plants pulled from the earth, and they could do nothing but hold them and cry. And here is the context that turns an apparently simple biblical passage into something of overwhelming depth. 2 Kings chapter 4 tells the story of the Shunammite woman, a wealthy woman who had been generous to the prophet Elisha. Elisha promises she will have a son, and the son is born. The child grows. One day the boy goes to the field to find his father during the harvest, and suddenly he says, "My head, my head." The father tells a servant to take the boy back to his mother. The boy sits on his mother's lap, and at noon, he dies. The symptoms, sudden and severe headache on a workday in the field during the harvest, are consistent with severe heat stroke, hypothermia, the brain cooking inside the skull, or possibly bacterial meningitis, which also presents with an explosive headache and can kill in hours. The woman places her dead son on the bed, closes the door, and rides to Mount Carmel to find Elisha. When she arrives, she grabs the prophet's feet and says, "Did I ask my Lord for a son? Did I not say, 'Do not deceive me'?" That cry echoes through 3,000 years. It is the cry of every mother who has ever lost a child. And in the biblical world, it was a cry that 1 in 3 mothers had to give. Childbirth itself was already a mortal threat. No obstetricians, no safe C-sections, no fetal monitoring, no antibiotics for postpartum infection. Genesis 35 tells of the death of Rachel, Jacob's beloved wife, during the birth of Benjamin. The text says she had a hard labor and that the midwife tried to reassure her by saying, "Do not fear, you have another son." But Rachel was dying, and as life ebbed away, she gave the son the name Ben-Oni, son of my sorrow. Jacob later changed the name to Benjamin, son of my right hand, but the original name, the name the dying mother chose with her last breath, was about pain, pure pain. 1 Samuel chapter 4 records another death in childbirth, the daughter-in-law of the priest Eli. When she heard that the Ark of the Covenant had been captured by the Philistines and that her husband and father-in-law were dead, she went into premature labor. The women around her tried to console her by saying, "Do not fear, you have borne a son." But she did not even respond. She named the son Ichabod, the glory has departed, and died. Researchers estimate that maternal mortality in the ancient world was about 1 to 2% of births. It may seem like a small amount, but do the math. A typical woman in the biblical world had between 6 and 8 pregnancies throughout her life. With a 1.5% mortality rate per birth, the cumulative chance of a woman dying in one of her labors was about 9 to 12%. 1 in 10 women. Look at 10 women in your life, your mother, your sisters, your friends. Statistically, one of them would not have survived. And even those who survived childbirth faced the risk of puerperal infection, childbed fever caused by bacteria that invaded the uterus during or after birth. Without antibiotics, puerperal fever had a mortality rate of 25 to 50%. You survived the birth, but died of fever 3 days later with the baby in your arms. It is in this scenario, in this constant biological battlefield, that we need to understand the role of healers, folk remedies, and the few substances that actually worked in the biblical world. Because in the midst of all this horror, there were a few things that helped. Few, but they existed. The prophet Isaiah, chapter 38, records one of the few specific medical treatments mentioned in the Bible, and it is fascinating because it works. King Hezekiah was mortally ill. The text says he had a boil. The Hebrew word shechin suggests a severe boil or abscess. Isaiah gave the instruction, "Take a cake of figs and apply it to the boil." They did this and Hezekiah recovered. A fig poultice on an abscess. It sounds like a grandmother's remedy. But research published in the International Journal of Antimicrobial Agents demonstrated that fig extracts possess real antibacterial properties against Staphylococcus aureus and other common bacteria in skin infections. Figs contain proteolytic enzymes such as ficin, which help dissolve necrotic tissue. They work as a natural debriding agent, cleaning the wound from the inside out. The hot fig paste applied to an abscess would have helped drain the pus, clean the dead tissue, and fight the bacterial infection. It wasn't magic. It was empirical pharmacology, something that worked, even if no one knew how to explain why. Olive oil was another therapeutic pillar of the biblical world that had real efficacy. The parable of the Good Samaritan in Luke 10 describes the Samaritan treating the assaulted man's wounds with wine and oil. Wine, which contains alcohol, an antiseptic, and oil, which creates a protective barrier over the wound, preventing the entry of dirt and bacteria, in addition to maintaining the moisture necessary for healing. This treatment was so widespread that Isaiah chapter 1 mentions wounds not softened with oil as a sign of total neglect. It was the basics of the basics, the minimum that was done for any wound. And it worked. Not perfectly, not like a modern antibiotic, but enough to make the difference between a wound that healed and one that gangrened. Balm of Gilead, mentioned in Jeremiah, "Is there no balm in Gilead?" was an aromatic resin extracted from trees in the Transjordan region. It was so valued that the Queen of Sheba took it as a gift to Solomon. Flavius Josephus reports that the balm plantations in Jericho were so valuable that Cleopatra convinced Mark Antony to gift them to her. The balm was used to treat wounds, burns, and muscle pain. Modern chemical analyses of similar resins identified compounds with anti-inflammatory and antimicrobial properties. It wasn't a panacea, but it was something real in a world where almost everything was a placebo or poison. But these successes were tiny islands in an ocean of unanswered suffering. For every wound that healed with oil, there were dozens that infected and killed. For every abscess drained with figs, there were hundreds that spread through the bloodstream and caused sepsis, death by generalized infection with extremely high fever, delirium, and organ failure. And the person died in agony without anyone around being able to even name what was happening inside their body. And it is exactly this helplessness, this total impotence in the face of disease, that explains something that modern reading of the Bible frequently ignores. The reason why healing was the most important miracle, not the multiplication of loaves, not walking on water, not calming storms, healing. The Gospels record more healing miracles than any other type of miracle, and now you understand why. Because in that world, disease was not an inconvenience. It was existential terror. It was the most present, most unpredictable, and most implacable force of daily life. It could take your child in one night. It could expel you from your community in 1 week. It could turn a powerful king into a corpse covered in worms. And no one, no doctor, no priest, no king, could do anything about it. So when someone appeared and healed, really healed, instantly, completely, the impact was not just spiritual, it was civilizational. It was a rupture in the natural order of things so radical that people didn't know how to process it. Mark chapter 2 says that when Jesus healed a paralytic in Capernaum, the crowd was amazed and said, "We never saw anything like this. We never saw anything like this." In a world where seeing someone die of disease was daily life, seeing someone be healed instantly was unimaginable. But there was a category of suffering in the biblical world that was even more terrifying than physical illness, because it didn't attack the body, it attacked the mind. Mental illnesses in the ancient world had no name, they had no diagnosis, they had no treatment, and above all, they had no natural explanation. If you broke your leg, everyone understood. You fell, the bone broke. If you had a fever, popular logic said something entered your body, some bad air, some impurity. But if you suddenly started talking to yourself, screaming for no reason, throwing yourself on the ground, mutilating yourself, not recognizing your own family, what did the people around you conclude? That something had taken over you from the inside. Something invisible, something with its own will. Evil spirits, demons, possession. And before you dismiss this as primitive superstition, understand what these people were actually seeing. They were seeing epilepsy, violent seizures that made the body writhe on the ground, foam coming out of the mouth, eyes rolling back. Mark chapter 9 describes a boy who had exactly these symptoms. The father tells Jesus that a mute spirit seizes his son, throws him to the ground. He foams at the mouth, gnashes his teeth, and becomes rigid. He says the spirit had already thrown him into the fire and the water, meaning the seizures happened at random moments, causing burns and near drownings. The father says this has been happening since childhood. The description is a textbook case of generalized tonic-clonic epilepsy. Perfect, precise, clinically flawless. But no one in the first century knew what epilepsy was. What they saw was a boy being destroyed by something they couldn't see, couldn't touch, and couldn't stop. They were seeing schizophrenia, the fragmentation of the mind into voices that others do not hear, visions that others do not see, a parallel reality inhabited only by the sick person. The Gerasene demoniac in Mark chapter 5 is perhaps the most detailed case of mental illness in all of ancient literature. He lived among the tombs. He cried out night and day. He cut himself with stones. He was so violent that not even chains could hold him. The text says he tore the chains apart and broke the shackles. When Jesus asked his name, he replied, "My name is Legion, for we are many." The fragmentation of identity, self-harm, isolation, superhuman strength in episodes of crisis, fragmented speech, and the sensation of housing multiple entities within oneself. To a modern psychiatrist, the picture is recognizable. To the people of that time, it was absolute horror. A human being whose interior had been invaded and conquered by dark forces, and they were seeing severe depression, what the Bible describes as an evil spirit that tormented King Saul. 1 Samuel chapter 16 says that the Spirit of the Lord departed from Saul, and an evil spirit tormented him. The result? Saul had fits of uncontrollable rage, constant paranoia. He pursued David for years, convinced he was conspiring to take his throne. He had episodes of weeping. He made erratic decisions. And in one of the most revealing episodes, he tried to kill David with a spear, while David was playing the harp to calm him. Music therapy, using music to relieve mental torment, is perhaps the first psychiatric treatment recorded in human history. And it worked partially. The text says that when David played, Saul would be refreshed and be well, and the evil spirit would depart from him. But the relief was temporary. The spirit always returned. Exactly how chronic depression works, periods of improvement followed by brutal relapses. Saul's tragedy ends on Mount Gilboa, where, defeated in battle and surrounded by enemies, he falls on his own sword. Suicide. The final outcome of an untreated mental illness in a world that had no tool to treat it. And it is here that we need to talk about something that is not in the medical diagnoses, but that was as real and as lethal as any bacteria or parasite: the stigma. Because the biblical world not only did not treat mental illnesses, it punished those who had them. The mentally ill person was expelled. They lived among the tombs because they could not live among the living. They were chained because they were considered dangerous. They were considered unclean, cursed, rejected by God. And this belief that disease was divine punishment was not limited to mental illness. It permeated everything. Job's friends spent entire chapters of the oldest book in the Bible arguing that Job's tumors, losses, and suffering were the consequence of some hidden sin. John chapter 9 records the disciples asking Jesus about a man born blind. "Master, who sinned, this man or his parents, that he was born blind?" The question reveals the universal assumption of the time. Someone sinned, always. Disease is punishment, always. And Jesus answered something that destroyed this logic. Neither this man nor his parents sinned. 5 words that demolish centuries of retribution theology. Neither he nor his parents. Disease was not punishment. It was not deserved. It was no one's fault. Now step back. Look at the entire panorama we have built over the last hour. See the complete picture. A world where 1 in 3 children died before age 5, where 1 in 10 women died in childbirth, where life expectancy was 35 years, not because people couldn't grow old, but because so many died young that the average plummeted, where parasites lived inside practically the entire population, where a toothache could be a death sentence, where leprosy expelled you from society forever, where a simple skin infection could turn into gangrene and kill you in days, where mental illness turned into a prisoner chained among tombs, and where the only answer most people received was, "You must have sinned." This was the real world of the Bible, not the world of colorful maps in Sunday school books, not the clean world of illustrations with smiling shepherds and green fields. The real world, the world that smelled of open wounds, of latrines without sewage, of bodies being prepared for burial. The world where death was not an event, It was a permanent neighbor, and that is exactly why you need to completely recalibrate how you read every healing miracle in the Gospels. When Jesus touches a leper in Matthew chapter 8, he is not just healing a disease. He is touching someone who had not been touched by another human being for years, perhaps decades. Someone who had to shout unclean to drive away anyone who approached. Someone who lived in a state of social death so complete that physical healing was almost secondary to the restoration of humanity. When he heals the woman with chronic bleeding in Mark chapter 5, 12 years of bleeding, 12 years of ritual impurity, 12 years spending everything she had on doctors who solved nothing, he is not just stopping a hemorrhage. He is giving her back 12 years of stolen life. He is saying she can go back home, to the synagogue, to the community, that she can be touched again, that she can live again. And when he says to the paralytic of Capernaum, "Get up, take your mat and walk," in a world without wheelchairs, without accessibility ramps, without social assistance, where a paralytic was completely dependent on charity of others and lived one step away from beggary and hunger, he is not just restoring mobility, he is restoring existence. Every healing recorded in the Gospels, when read against the medical background we explored in this video, is transformed from a demonstration of power into an act of mercy so profound it is almost hard to bear. Because now you know what those people were living through before the miracle. You know how long they had suffered. You know how many healers they had visited without result. You know what the surrounding society said about them, that they deserved it, that they had sinned, that they were being punished, and someone appeared and said, "No, you do not deserve this. This is not punishment. Get up." And now for the reflection you need to take with you when you close this video. We live in a world that those people could not even imagine. You have at home, at this moment, things that would have been considered absolute miracles in the biblical world. Ibuprofen, a pill that makes the pain disappear. Antibiotics, substances that kill infections that would have killed you in a week. Treated water, clean, coming out of a faucet, without parasites, without bacteria, without amoebas. Vaccines, injections that make your body become immune to diseases that exterminated entire cities. Anesthesia, the ability to be operated on, cut, opened, and feel nothing. Infant mortality in the developed world today is less than 0.5%. In the biblical world, it was 40%. Global life expectancy today is 73 years. In the biblical world, it was 35. We live, literally, in the world the prophets dreamed of. Isaiah 35 describes the Messianic era as a time when the eyes of the blind shall be opened, the ears of the deaf unstopped, the lame shall leap like a deer. Ophthalmology, hearing aids, orthopedic prostheses. We are there, not by the route the prophets imagined, perhaps, but we are there. And there is something disturbing in this realization. Because we have all this and we don't notice it. We take an antibiotic without thinking about the fact that 100 years ago, the infection it cures would have killed us. We bathe our children with treated water without thinking about the mothers who lost theirs because the river water had parasites. We go to the dentist to complain about a filling without thinking about the man in the 1st century who died because a dental abscess infected his brain. We live surrounded by medical miracles and call them routine. And perhaps the greatest value of looking back, of understanding what it was really like to live in the world of the Bible, is not academic. It is not historical, it is existential. It is realizing with a clarity that cuts to the bone that what we have is not normal. It is not guaranteed. It is not permanent. It is extraordinary. It is fragile. And it is recent. So recent that your great-grandparents were born in a world that still looked more like the biblical world than yours. The next time you read about healing in the Bible, don't read it with the eyes of someone who has a pharmacy on the corner and a hospital 20 minutes away. Read it with the eyes of someone who has nothing, of someone who lives with worms in their gut and abscesses in their mouth, of someone who has already lost 2 children before age 5 and is pregnant with the 3rd without knowing if she survives the birth, of someone who knows that her husband's cough could mean that in 3 weeks she will be a widow. Read with those eyes, and then, only then, will you understand why crowds walked for days in the desert to get close to someone who healed. Why mothers broke through roofs to lower their paralytic sons. Why a woman with a hemorrhage crawled through a crowd just to touch the hem of a garment. It wasn't fanaticism, it wasn't naivety, it was desperation. The purest and most human desperation there is. The desperation of someone who is sick in a world that has no cure. And if you've made it this far, click on the next video appearing on your screen. I've selected it especially for those who watched this one until the end.